I think we all know that infection is defined as infections in the vertebral body, yeah, intervertebral disc and adjacent paraspinal tissue, and also it's able to cause significant pain and disability, and become a world problem also in our country, in Indonesia, I think. And one of the most common spinal infection is in my country, actually TB infection. As we know that the most common cause of bacteria are Mycobacterium tuberculosis, and actually the permanent neurological disability is a very important issue in my country to be a complication or the rest of symptom which should be treated well in my country. So we know that repercussion of TB spine actually, from literature, said that if we don't debride, if we debride TB without TB drug, yeah, there is mortality 70% and decrease if we do the debridement with the TB, and if the TB infection with neurological deficit, the mortality will increase until 60%. We know also that paraplegia and quadriplegia is also the complication that sometimes very important sign in our country, in my country, and also the deformity, kyphosis, and the most dreaded complication of the TB spine infection. The major risk factor for increasing this deformity, actually, of course, the extensive involvement of the vertebral body. So in my country, based on our 20 years follow-up of patient, if we don't treat the vertebral body defect more than 2 vertebrae, we will find the pseudoarthrosis and cannot make fusion of spine. So if we do a spinal instrumentation, the implant will be failure. We have 25% case with this extensive involvement of the vertebral body. So I think we are always to develop our system to do this problem. So in the total treatment means, yeah, that introduced by Professor Subroto Saparan in 1984 at Cipto Mangunkusumo Hospital, has the philosophy of a guide to management of TB by dividing 10 treatment, and the aim to cure, to stabilize, to relieve pain, correct the deformity, and restore the function. So I think it is the very important aim of our treatment, and the important of this aim are allow patient to return to their social, family, and work environment. So in the concept of, or in the philosophy of total treatment, which we are developed, are how to treat the patient all over patient life. Not only one shoot at the first, but also in the total life. So that's the meaning of the total treatment. So we can see the patient back to and come into their social, family, and environment. What was the strategy? So yeah, we have 14 problems faced by patients with tuberculosis spondylitis that must be identified. Yeah, the 14 most problem are general condition, instability, lesion, multiple lesion, deformity, collapses, painful infection, fracture, progressive kyphosis, neurological deficit, cardiovascular disorder, impaired lung function, socioeconomic problem. Of course, it is especially in our country. And sometimes we have the problem of psychogenic problem. So the first patient come to us, we should know this problem first, and then we make a strategy to this. Yeah? The stage identification and clarification, and always make a list of treatment modalities and make a customized problem list with appropriate treatment and look for the most suitable treatment option. So many doctors in many spine surgeon, for example, should be treat and should be do this step of stage. Identification problem, clarification, make a list, and custom the problem list and make appropriate treatment and look for the suitable treatment. So there are 10 alternatives actually. Yeah, they are should be actually based on the lesion type: minimal, anterior lesion, anterior posterior lesion, or anterior and or posterior lesion. We should evaluate the patient condition, and the last, I mean the right column are how to make a strategy to treat all this problem identification. So after we make a list, then we do some and develop multiple approach. And we have 5 modality based management approach. Chemical, of course, we need to give some chemical, drug, and many. Physical, sometimes we need to put some support. Psychist, of course, we treat this. Mechanical, doing surgery, open, minimal, and many kind of approach. And of course, I think it is the future medicine, biological. It's mean right now we have also stem cell and metabolic product to put on lesion. Yeah. So this approach can be single or also can be combined. So this multiple approach, they aim to reduce complication during management of spinal infection and to restore spinal structure, of course. We should consider 4 aspects: biological, mechanical, of course, electrophysiology, and risk and complication assessment. So for aspect, we have 4 aspect multimodal approach: biological, biomechanic, and of course we evaluate risk and complication. Yeah. What is the biological aspect? Yeah. We need killing bacteria with any kind of approach, antibiotic, debridement. Sometimes we need autotransfusion, and we put tissue engineering. Mechanical aspect, anterior, posterior surgery technique, and of course we correct the deformity and makes the proportion of the body with the limbs better. We don't do the we should make a proportion of the vertebral body which diminished before, and of course we make the spinal structure more strong. Every approach should be consider the function of nerve. We always check the electrophysiology aspect, and of course, everything related to risk and complications should be assessed. We have developed C-score, it's mean spine surgery injury severity score. So if we are planning to do surgery, we should always whether this score or the prediction will be I mean the severity of injury will be I mean there will be make the condition bad or better. So we think of our surgery will be make a good condition or not after surgery. So this is the diagram of multimodal approach. This is the approach we should be considered: biological, biomechanical, electrophysiology, and risk and complication assessment, preoperative. So we need to check killing bacteria, spinal support, general condition, brace, implant, and many. And then we check this whether everything will be work preoperative, intra, and also early or delayed postoperative. So in the total treatment, we should evaluate pre, intra, and postoperative, early and delayed. And we perform a diagnosis to make a mapping, of course, and obtain a list of problem and resolve this problem using the approach. I want to show some cases with our this total treatment. This is the case one is a 13 years old boy with TB of cervical and lumbar. Actually, this patient has, you can see here, the mass. I guess it is, of course, abscess. Impaired balance and stiffness when walking, weakness in both extremity, and hard to eat and can't sleep well. So you can see, destruction on the C5, and you can see abscess at the level of C1 to C4. And if you see at the lumbar area, you can also the infection at the L4. So, okay, we can see here, the abscess. Okay, so of course we check what is the problem identification and clarification. Of course, we do physical examination, CT scan result, MRI, and we check with what about the all level of the vertebrae. Sometimes we need to check this not only the vertebrae with the complaint, but also the whole spine. And we make a list of the treatment. Doing mechanical approach, abscess evacuation, chemistry, chemical, we do local antibiotic administration, of course, and then sorry, this is not percutaneous laser, this is the common, but percutaneous aspiration of the abscess, and we give local antibiotic we put on the abscess, and the next step, we should repair the defect in by putting the stem cell.
One more minute.
We don't open this abscess. We just take by aspiration. We can get until 100 cc. The step 2. Okay, sorry, this is I mean just putting at the L4, we inject the antibiotic to the lesion, okay, and this is 2 weeks after our procedure.
Lehernya sakit nggak? Leher sakit? Udah enggak? Ya, ulang lagi sih. Lehernya sakit nggak?
Okay, the second case, 46 years old female.
Dr. Rahyussalim, you got another minute to complete,
Okay.
please. Yeah.
Okay, yeah. I think it is, but I want to show the last cases, I think. Yeah. This patient with, with more one defect of vertebral body, yeah. This patient with always failure of implant, yeah. Okay. And then we put stem cell and on the scaffold. Okay. And then you can see after this is the fourth surgery, because the patient has twice failure of the implant after the third surgery. Yeah. Okay, the conclusion is actually the multiple approach of mechanical, chemical, and biological should be applied into overall total treatment of TB spinal infection, because we need to see the whole life of the patient. We want patient come to the social, and the treatment of TB spinal infection should be follow this step: evidence-based treatment, and problem-based treatment, and result-based treatment to define problem-solving targets. I think, thank you very much.